Hi everyone, so we're going to go over terms and important concepts for chapter 11, which focuses on the lives of older women. So ageism, also known as age discrimination, is prejudice related to a person's actual or perceived age. So stereotypes of older people are a mix of positive and negative, what we might call hostile or benevolent discrimination. So overall, it's more negative than those towards younger adults, and it varies by intersectionality with gender, race, sexual orientation, etc. So, for example, in the Native American culture, elders are often sort of venerated, looked to as people you should go to for advice. Unfortunately, in sort of mainstream Western culture, they're sort of not seen a lot of times. So they might be seen as frail, forgetful, less confident, but also as warm, caring, and communal. So again, if you don't fit those stereotypes, if you're sort of the uppity old lady, right, then you might run into some problems. So how do older adults see themselves? So there's what's called stereotype embodiment theory. This is really similar to stereotype threat that we've talked about before. So this is the idea that people learn age-related stereotypes at a young age, internalize them as self-stereotypes, and are subsequently influenced by them in their thoughts and actions. So the biggest impact is on domains that people really value. So for older adults, it might be things like health and well-being. And you can avoid this by just not identifying as old, even when other people label you that way, and viewing your age as a positive thing. I've survived this long. So appearance concerns may arise, especially for older women, because beauty for women is equated with youth, whereas older men are often seen as distinguished. So beauty work is beauty and body modification done to conform to social norms of attractiveness. And this can be everything from wearing makeup or certain clothes like Spanx, what used to be called girdles, all the way to undergoing much more invasive procedures. So age concealment is beauty work undertaken to hide signs of aging and be able to pass as younger than one's chronological age. So you'll see something as simple as dyeing your hair to cover up grays, removing facial hair, which tends to grow more as you have hormonal changes as you age. And then you might have surgical or non-surgical interventions to remove wrinkles and tighten skin. So surgically, this could be something like a facelift. Non-surgically, this could be something like collagen injections or even botulism toxin or Botox. So menopause is the permanent end of menstrual periods, and that resulting from decreased hormone production in the ovaries, somewhere around age 50, although there's a wide variation here for women. So what we typically think of when women talk about being in menopause is actually perimenopause. And this is the last few years before and the 12 months after a woman's last menstrual cycle. And women will experience a lot of physical changes. So changes in the length and regularity of their menstrual cycles, hot flashes, night sweats, and then vaginal dryness. So if they've not had to use them before, they may have to start using lubricant. And then postmenopause is the period beginning a year after you've had your last menstrual period or have had your ovaries removed, which is what an ovarectomy is, and continuing till the end of a woman's life. So if you have something like a cancer and you have to have your uterus and ovaries removed younger, you'll go through menopause at a younger age. Now, in terms of physical health, I wanted to cover this, even though this isn't technically terms, just because I think that this is really eye-opening to a lot of people. A lot of people just sort of assume that breast cancer is the #1 killer of women, but in fact, it's heart disease, just like it is for men. Onset does occur later in life for women than men, and it's often undiagnosed because the symptoms women have are different than those that men have, and medical textbooks were written primarily based on research on men. Because for years they didn't do research on women because those hormones might complicate things, as if men didn't have any hormones, right? So for women, for example, something like a heart attack might present more with nausea than what we think of as the typical like chest and arm pain. So it's really important that doctors are educated about this and that women themselves are educated so they can advocate for themselves getting proper diagnosis rather than being dismissed with a stomachache or some sort of anxiety attack. Breast cancer is the most commonly diagnosed cancer in women, but lung cancer is the leading cause of cancer deaths for women, except for Hispanic women. Other things that really affect women that receive less attention include osteoporosis, osteoarthritis, and dementia. So dementia can include Alzheimer's disease, but can also include things like vascular dementia, Lewy body dementia, dementia related to other medical conditions. And these disproportionately affect women, and they pose very serious risks. Pinkwashing is something related to this idea that like breast cancer is the #1 thing that we need to talk about for women. There are a couple things that happen here. So in terms of just talking about breast cancer in general, it's an easy conservative way to talk about women's health and to feel like you're not excluding women. People don't mind talking about it because it's about the breasts, and women in our objectified society are often sort of equated with that, right? So pinkwashing is highlighting of a company's or organization's concern for breast cancer by promoting pink or pink ribbon products. Now, this is not always a bad thing. Sometimes this money goes almost entirely to important things, funds that, for example, help breast cancer research or support survivors of breast cancer. However, these efforts are largely focused on individual awareness and screening. And in fact, if you look at a lot of the pinkwashed products, they'll just say, we'll donate money to raise awareness to breast cancer. It's like, we're all pretty aware. Let's do something about it, right? And pinkwashing can distract from more systemic changes that might need to take place, like identification and removal of environmental toxins linked to cancer. Now, within the healthcare system, older women in particular are often infantilized by medical professionals. There's a concept called elder speak, which is a pattern of speaking aimed at older adults, and tends to be worse for older women, characterized by simplified speech, a high pitch, and exaggerated tone. It's really similar to how we talk to infants, which again, insulting, clearly. So infantilization and the use of elder speak can exacerbate negative stereotypes about older adults and can also make them less likely to seek medical care because they don't want to be treated this way. Now, in terms of caregiving, family caregiving is unpaid assistance provided to an older adult or an adult with chronic or disabling conditions, and 60% of these unpaid caregivers are women. A spouse is the family member who provides the most, and oftentimes so you'll have older women taking care of an older man with something like Alzheimer's, which in the later stages they get to the point where they might be violent unintentionally and not know who they're talking to, so this can be potentially dangerous for the woman. And caregiving itself is associated with chronic stress, poorer mental and physical health, social isolation, and loss of income. And what happens for a lot of sort of middle-aged people is they end up with what's called the sandwich generation, where they might be still caring for their children, but also having to do caregiving for their parents. Alternatives to family caregiving, like hired help or living in an assisted living facility, can be prohibitively expensive, thousands of dollars a month. No one can afford that. Bereavement, most women with male partners will outlive them. This is something called the widowhood effect, where there's an elevated risk of mortality following the death of a spouse. If you've seen the movie The Notebook, they sort of romanticize this, right? Women are less likely to remarry after the death of a spouse than men are. And bereavement is grief associated with losing a relative or a close friend through death. And so not only is this an emotion, but it's also a recognized psychological issue that people deal with. Disenfranchised grief is grief that can't be expressed openly because the loss is not recognized or acknowledged by those around the bereaved individual. So this might happen with, for example, an older lesbian woman who hadn't disclosed their relationship. Now, in terms of children, experiencing an empty nest, it's supposed to be not an empty nest, is beneficial for most adults, which is surprising because we always think of this as sort of like a negative thing. But it's especially helpful for women. So there's the role strain relief hypothesis, which is the idea that parents, particularly mothers who, as we've talked about already, tend to provide the majority of the childcare, have increased well-being after children leave home because of the decrease in daily demands, time constraints, and work-family conflicts. Some women do report ambivalence towards having the empty nest. So empty nest syndrome is the experience of depression, loneliness, identity crisis, or emotional distress after kids leave the house. Role loss hypothesis is where parents, especially again moms, will experience a decrease in their well-being when they don't have this role that has given them so much meaning. And then there's the launching phase, which is the period during which children are in the process of leaving the parents' home. And unfortunately, due to the economy, the proliferation of unpaid internships, this launching phase has gotten longer and longer in those in the millennial and Gen Z generations. Now, in terms of retirement, generally this is pretty positive for everybody, but it can result in a loss of role identity, which can be really difficult. Some people, because of that, will do what's called bridge work. They'll work, say, part-time after they retire from their job. And this provides a transition between employment and full retirement, gives them something to do, a little bit more disposable income. For example, I have a neighbor who retired after working at the shipyard. He loves to golf, so he works at our local golf club. Women are often financially unprepared for retirement and because they haven't been given as good advice about things. And then leisure innovation is engaging in new leisure activities as part of retirement. And this can provide the mental stimulation lost by leaving work. So a retired professor I know was one of the first people to go and travel to Cuba after it opened, for example. So how do you age successfully? So successful aging focuses on neutral and positive aspects of aging. Active aging focuses on being an active member of one's community. So people will get more involved sometimes in, for example, charity work, volunteer work. Harmonious aging focuses on balancing the challenge and opportunities that aging presents. And then resilient aging acknowledges that one can have strength despite challenges or hardships. So these approaches could be replaced by a focus on social change that creates better conditions for people to age. And this is something that psychologists have talked quite a lot about. So for example, Erik Erikson talked about this being the time in your life when you kind of look back and think, what can I do to help those coming up behind me? All right, so brief terms this time around, and I will see you in the second half of the